pelvis by lesser sciatic foramen. So these three structures, the last three structures, after short course in the gluteal region, they come back to the hip by passing from lesser sciatic foramen. So this slide is important. A structure up to the piriformis, down to the piriformis, and a structure come back to the pelvis by lesser sciatic foramen. What are the structures passing from the lesser sciatic foramen? So three structures come back to the pelvis. Pudendal nerve, internal pudendal vessels, and nerve to obturators. Yes. They go out from greater foramen, coming by lesser sciatic foramen. One muscle in the lesser sciatic foramen, obturator internus muscle. Obturator internus muscle. So these are the four structures. Muscle in posterior compartment of the thigh. Fortunately, we have three muscles. Just three muscles. Look at the name. Biceps femoris. It has two heads, short and long, same as the biceps brachii. But here we have posterior side of the thigh, we have biceps femoris. Semitendinosus, look at the name. Semitendinosus, semimembranosus. What can I understand from the name? Semimembranosus.
Membranes of obturator.
Half of the muscle is membrane. Half of the muscle is look like a membrane. Semitendinosus. Half of the muscle is look like tendon. So it has a big, long tendon. Semitendinosus. Semi means half. Tendinosus, tendon. Half of the muscle is tendon. Semimembranosus. Half of the muscle is membrane. Look like membrane, the shot. So I told you, posterior compartment of the thigh, we call them hamstring muscles. Hamstring muscles, they had three features. What was the features?
They attach to ischial tuberosity. They have innervation from ischial vein, sciatic vein, and they are all flexor.
No,
Extension.
Yes. So, hamstring muscle again, they have three structures. They start from ischial tuberosity, innervated by sciatic nerve tibial part. Why you say that? Sciatic nerve tibial part. I told you, sciatic nerve divides to the two nerve here in the popliteal fossa, tibial nerve and common fibula. But in upper part we have one nerve, one sciatic. But in this side you can see one medial, one lateral. Medial we say tibial part of the sciatic nerve. Lateral we say common fibular part of the sciatic nerve. Function of the hamstring muscles are extension of the hip, and you can say flexion of the knee, extension of the hip. All of these three muscles, they are hamstring, except short head of the biceps. Short head of the bicep is not hamstring. Why?
Because it is not attached to ischial tuberosity.
One, it's not a start from ischial tuberosity. Short head just start from femur, from linea aspera. Another reason. Innervation is different. Very good. The third, it can't extend the hip because it starts from here and finish here, so it can't. So it doesn't have the three features. Short head of the biceps is not hamstring because hamstring muscles start from ischial tuberosity. They can extend the hip, and they are innervated by sciatic nerve tibial parts. We get here ischial tuberosity, sciatic nerve tibial part, extend the hip and flexion the knee. Look at here. Let's start from ischial tuberosity, innervate by sciatic nerve tibial part, extend the hip here. So except the short head of the biceps is not hamstring. It's not a start from ischial tuberosity, it's a start from linea aspera, lateral border of the linea aspera. It's not innervated by sciatic nerve tibial part. It's innervated by common fibular part or common peroneal part. It can't extend the hip just for legs and lateral rotate. Okay, so shorted is not hamstring. Sciatic nerve has two branches, tibial branch and common fibular. Common peroneal means common fibular, same. So let's checking the muscles here. So from posterior view, it's a little hard for me to find which of them is biceps, which of them is hamstring. Look at here, they all look like together, this one. Which of them biceps, which of them semitendinosus, hamstring. Find the lateral and medial. So this is medial, this side is lateral. Yes, this is midline body, this side is lateral. Biceps going to the lateral. So this muscle is biceps. Attached to the head of the fibula. Insertion of the biceps is head of the fibula. So this muscle is biceps. But the medial muscle is semitendinosus. So medial band, semitendinosus, lateral band, biceps. Where is the semimembranosus?
Medial.
Deep to the semitendinosus. When you remove semitendinosus, you can see semimembranosus. It's here. Deep to the semitendinosus is semimembranosus. Okay? What is the function? They can, all of the muscles here, they can extend the hip and flex the knee. So posterior compartment, they are flexor to the knee. But anterior compartment, quadriceps, extensor. Okay? Posterior compartment of the thigh, flexor of the knee. Anterior extend. Hamstring muscle, they also can extend the hip. So which muscles they can extend the hip? Hamstring muscles and gluteus maximus. Gluteus maximus also can extend the hip. Which muscle can abduct the hip? Gluteus medius minimus and most of the muscle in the deep layer. Piriformis, obturator internus, gemellus superior, inferior. Which muscle can flex the hip? You tell me. Flex the hip, which muscles? Anterior compartment, some muscles. For example, sartorius
Psoas major.
Sartorius a little, rectus femoris a little, but the main flexor, iliopsoas.
Iliopsoas.
The beginning of the today lecture I told you, iliopsoas, iliacus and psoas major. They are flexor of the hip. So if you arrange them by the action, you can see these muscles. And finally, adductor of the hip, thigh, adductor muscles. Adductor longus, brevis, magnus, pectineus. Let's talking about insertion. Origin is obvious. Ischial tuberosity. And I told you the exception, insertion. Biceps attached to the head of the fibula, okay? Semitendinosus, start from ischial tuberosity, attached to the medial side of the tibia. Medial side of the tibia. Medial side of the tibia, we have three muscles. Sartorius from anterior compartment. Gracilis from medial compartment. Semitendinosus from posterior compartment. So medial side of the tibia, we have tendon of three muscles. Medial side of the tibia, we have tendon of three muscles. From anterior to posterior, sartorius, gracilis, semitendinosus. Attachment of the sartorius, gracilis, semitendinosus. These three muscles attached to the medial surface of the tibia. One anterior compartment, sartorius. One medial compartment, gracilis. One posterior compartment, semitendinosus. Yes. And semimembranosus, biceps, head of the fibula, okay? semitendinosus here. Where is the insertion of the semimembranosus? It's here, attached to this groove. Groove behind the medial condyle in the tibia. Tibia has medial condyle, lateral condyle. This muscle attached to the groove behind the medial condyle. Attached here, semimembranosus. Groove behind the medial condyle of the tibia. But the tendon not finish here. The tendon not finish here. It has an extension, goes up and lateral. So the tendon of muscle attached to the groove behind the medial condyle, semimembranosus. But the tendon has extension, goes up and lateral. Tendon attached to the groove behind the medial condyle, semimembranosus tendon, okay? But this tendon has an extension, goes up and lateral. What is the name of this extension?
Oblique popliteal.
Oblique popliteal ligament. In the popliteal fossa, okay, and it's oblique. Oblique popliteal ligament. So if I ask you, what is the origin of the oblique popliteal ligament? Don't confuse. What is this name? Oblique popliteal ligament. No, this is the extension of the semimembranosus tendon. I start from here, attached to the condyle of the femur. Lateral condyle of the femur. Goes up and lateral. Oblique popliteal ligament. So these are three muscles in the posterior compartment of the thigh. We talked about all of them. They are hamstring, and the exception is here. Origin, innervation, and function is different. All of them. Look at the semimembranosus insertion attached to the back of the medial condyle of the tibia. It has an expansion, it goes up and makes oblique popliteal ligament. Innervation is the same, and action, and the three muscles extend the hip, flex the knee. Some muscles, they can do medial rotation. Medial muscles, semitendinosus, semimembranosus, they can medial rotate. But biceps, because goes to the lateral side, it can lateral rotate. Biceps goes to the lateral rotate. Semitendinosus and semimembranosus goes to the medial rotates. Popliteal fossa. This rhomboid fossa here. Popliteal fossa. What are the boundaries for this fossa? They have this shape. So you know about upper boundaries. Upper medial two muscle, semitendinosus, semimembranosus. They go to the medial side. Upper lateral biceps. Biceps is here. So upper lateral biceps, upper medial, semitendinosus, and semimembranosus. Okay. How about the lower boundaries? We have one muscle. The name of this muscle is gastrocnemius. Gastrocnemius. You sometimes see that. You see that we have two head muscle here, twins. Okay, it's here. The name of this muscle is gastrocnemius. In football player or a runner, they have very separated two heads. Okay, we say twins. Yes, gastrocnemius. One medial head, one lateral head. One muscle, gastrocnemius, but it has two parts. So these are the boundaries of the popliteal fossa. Up medial semitendinosus, membranosus, up lateral biceps, down medial and lateral gastrocnemius. What is the content of this fossa? So popliteal artery. Popliteal fossa, popliteal artery. Where is the origin of the popliteal artery? Popliteal artery.
Femoral artery.
Femoral artery, yes. Femoral artery after femoral triangle. going to the adductor canal, and adductor canal opening in the popliteal fossa. So femoral artery comes here. The name of the artery changed to popliteal artery. Femoral vein, so same as the artery, femoral vein. One nerve is here, tibial nerve. Tibial nerve, yes. What is that? What is this nerve?
A branch of the sciatic nerve.
Sciatic nerve. Sciatic nerve, posterior side of the thigh, divides into the two branches. Upper part of the popliteal fossa. We're talking about nerve, sciatic nerve. Yes, exactly.
One medial, one lateral.
Sciatic nerve here divides into the two nerves. One nerve tibial nerve, posterior side of the leg, then goes to the foot. One nerve,
Lateral. Common fibular.
look at here, goes to the lateral side of the leg, turning around the popliteal fossa and goes to the lateral side of the leg. Common pronal, or you can say common fibular nerve. So in popliteal fossa, we can see all of them. And sciatic nerve, before popliteal fossa divides into these two nerves. Tibial nerve, posterior side of the leg. Common fibular or common pronal goes to the lateral side of the leg. Okay?
Popliteal lymph nodes and fat.
Yes. But I told you, in the posterior side of the thigh, I told you, hamstring muscles, they receive sciatic nerve tibial part. What does it mean? It means sciatic nerve this part. This part is sciatic nerve tibial part. This part sciatic nerve fibular part. It means lateral and medial. Tibial part, medial side, fibular part, lateral part. But sciatic nerve is one nerve. So come back to the slide. Look at the contents. This is popliteal fossa. Look at the boundaries of muscle. We talked about them, okay. Look at the contents. Popliteal artery, popliteal vein, tibial nerve, and look at here, goes to the lateral side, common pronal. These are the content. Yes, you have some fats, lymph nodes. And we have some superficial structures. But about the main content, this picture is important. Look at here. What you get that from this picture?
Popliteal vein in the upper part are medial.
Popliteal artery in the upper part is medial structure.
But in the lower part as lateral.
Yes, but in the lower part of the fossa, popliteal artery goes to the lateral side.
The nerve opposite.
Yes, nerve opposite. Nerve, tibial nerve, in upper part is the lateral structure. Tibial nerve is in the upper part is the most lateral structure. Artery, vein, nerve. But look at the lower part change. Artery from medial goes to the lateral. Vein is medial again. Nerve from lateral goes to the medial. So here we have artery, vein, nerve. Here we have nerve, vein, artery. Change the order from lateral to medial. Another one, superficial to the deep. This is the order from lateral to medial. Up, artery is the most medial. Down, nerve is the most medial. Okay. Superficial to deep.
Artery is the most deepest, but
Yes.
nerve is the superficial.
Very good. Artery is the deepest structure, but nerve is the superficial, the most superficial structure. So from superficial to deep, we say nerve, vein, artery. You can see from the picture. So these orders are important. In surgery of the knee joint, in the
injection.
problem in the popliteal fossa, you should know where is the artery in the upper part, where is the artery in the lower part, where is the nerve in upper part, where is the nerve in lower part. and superficial to deep structures. What is the roof of the fossa? So we have a skin, superficial fascia, and superficial structures. What are the superficial structures? One superficial nerve here, posterior cutaneous nerve of the thigh. Yes, it's for a skin of posterior side. A small saphenous vein, I told you, we have great saphenous vein in medial side of the leg and thigh. One vein, a small saphenous vein, lateral side of the foot, goes up, finish in popliteal fossa.
Great dorsal.
Great in the medial side of the leg and thigh, but a small saphenous vein in the lateral side goes to the posterior side. So this superficial vein is a small saphenous vein. Finish in the popliteal fossa, in the popliteal vein. So this is superficial structure. What is the name of the deep fascia in the popliteal fossa? Popliteal fascia. What happened? I told you. Deep fascia of the lower limb is one layer like socks, jurab, in one layer here. In the thigh we say fascia lata, but in the popliteal region we say popliteal fascia. It's one layer. So popliteal fascia means deep fascia. Deep fascia is popliteal fascia. So boundaries, superficial region, contents, superficial structure. We have a small saphenous vein, is superficial vein, some nerves, posterior cutaneous nerve of the thigh, sural nerve I'll be explaining for you, and the main contents. What is the floor? What is the floor of the fossa? So femoral bone, femur, popliteal fossa. This ligament I told you, oblique popliteal ligament. These and capsule of the joint. These are the floor. Popliteal surface of the femur, here. This ligament, oblique popliteal ligament, and capsules of the joint. These are floor of the fossa. Contents, I told you, popliteal artery, popliteal vein, tibial nerve, common fibular nerve, and lymph nodes and fats. What is popliteal artery? Look at here, femoral artery, passing from femoral triangle, going to the femoral canal, passing from adductor hiatus, then goes to the popliteal fossa. Now I can see the artery here. This is popliteal artery. Popliteal artery has some branches. Some branches for muscles, muscular branch, okay. The most important branches are genicular branches. What happens? Look at here. Popliteal artery. Superiorly, it has one superior medial, superior lateral, genicular arteries. Genu, I told you, means knee. Genu means knee. Superior medial, superior lateral, genicular. Inferior, inferior medial, inferior lateral, genicular. Middle, center, genicular. So these are genicular branch for the genu, around the knee joint. Superior medial lateral, inferior medial lateral, and one middle. Genicular branches for the knee, and some muscular branches.
For the bone of the knee?
Bone of the knee, femoral received from femoral artery, tibia, fibula is received from the leg, that's here. Popliteal vein, it's deep vein, same as the popliteal artery. So, attached to the femoral vein and start from the veins of the leg, receive the same branches. And also a small saphenous vein finish in the popliteal vein. This superficial vein, a small saphenous vein, finish in the popliteal vein, I told you. Tibial nerve. Tibial nerve. Tibial nerve, I showed you, goes to the leg, posterior side of the leg. The most important nerve for the posterior side of the leg is tibial nerve. How about in the popliteal region? It has genicular branch. Superior medial, inferior medial, medial part of the genicular region. Okay?
From sciatic nerve.
Yes, divides by sciatic nerve. Sciatic nerve divides to the two nerves. Tibial and common fibular. This is tibial nerve. This one common fibular. Tibial nerve passing from popliteal fossa. It has genicular branch, superior medial, middle genicular, and inferior medial. They don't have lateral genicular branch. Lateral for fibular nerve. And finally, some branch for muscle. Finally, sural nerve. We had one question today. What is sural nerve?
A cutaneous.
The cutaneous branch of the tibial nerve in the popliteal fossa. So tibial nerve in the popliteal fossa, it has one cutaneous branch for the lateral side of the leg and foot. Posterior side of the leg, lateral side of the foot. The name of this branch is sural nerve. Sural nerves. So this is posterior compartment of the thigh, popliteal fossa,